If you have unpleasant sensations in your legs, coupled with an insatiable need to move them, you may have restless leg syndrome. Keep watching as we uncover more about this uncomfortable sleep disorder, the risk factors, causes, triggers, diagnosis, and treatment options. What is restless leg syndrome? Picture this scenario. You lie down after a tiring day. You close your eyes, and then it happens. You have awful tingling sensations in your legs, and the only way to temporarily relieve these sensations is to move your legs. This pattern goes on all night long, leaving you exhausted. If this is your experience, you may have a chronic neurological sleep disorder called Willis-Ekbom disease, WED, aka restless leg syndrome, RLS. What are the symptoms of RLS? This urge to move your legs usually arises during the nighttime hours when you're still. You can also experience this sensation during long car rides or flights. RLS mostly affects the legs, with symptoms being described as burning, tugging, itching, crawling, or gnawing feelings localized below the knees. Symptoms only occur at rest, stopping when you move. The sensations can affect both sides of the body or just one. They may alternate between both sides of the body, and the severity may range from mildly uncomfortable to very painful. Who gets RLS? This condition can manifest at any age and isn't gender-specific. Middle-aged women are at the highest risk for RLS. Most times, RLS runs in families. According to research, between 40 to 90% of patients have at least one first-degree relative, either a parent, sibling, or offspring, with RLS. If you have hypersomnia, depression, Parkinson's, Alzheimer's, diabetes, or low iron levels in your brain, or if you're of Northern European descent, you're at higher risk of developing RLS. RLS is sometimes seen in patients who are prescribed antidepressants for extended periods of time. What causes RLS? The root cause of RLS is unknown. Experts believe it's either genetic due to environmental factors or a combination of both. These factors cause a neurological imbalance in the brain that involves lower dopamine levels. Dopamine is responsible for sending messages to control muscle movements. Plus, many patients suffering from RLS have low body stores of iron. Sit tight, because we're about to introduce RLS triggers, diagnosis, and treatments. What triggers RLS? Knowing the triggers that exacerbate symptoms and avoiding them is vital for managing RLS. It's in your best interest to avoid stress, alcohol, strenuous exercise, smoking, caffeine, and triggering medications like OTC cold and allergy drugs. How is RLS diagnosed? RLS is usually diagnosed based on symptoms. There's no definitive test that can diagnose RLS. Some blood or neurological tests can be used to diagnose the condition, but they're not entirely conclusive. It's suggested that you document symptoms as precisely as possible before speaking with your doctor. The most crucial indicator of RLS remains the same: an unstoppable urge to move your legs that eases with movement. How is RLS treated? That depends on whether the condition is primary RLS, which is not related to another medical condition, or secondary RLS, which is related to another disease or medication. The primary condition should be managed for RLS symptoms to be addressed. If you have primary RLS, your symptoms can be managed in different ways. Remember, RLS is a chronic condition that cannot be cured. RLS due to low iron levels can be managed through iron therapy. RLS can also be treated with medications such as rotigotine and ropinirole. Sedatives may be prescribed for sleep. Symptoms can also be managed through exercise, including aerobics and lower body stretches. RLS is generally a lifelong disorder. However, symptoms may go into partial remission for days, weeks, months, or even years. Symptoms can be managed through effective treatments. It's a good idea to talk to your doctor to see which treatment is best for you. Help is available.